If I could do anything differently, I would have fixed this 5 years ago. The pain level on top of sleep deprivation and all of the other factors that played into that were really quite debilitating and life-changing. My name is Loren Vandergriff. I'm 45 years old. I live in St. Louis, Missouri. I am an orthopedic nurse practitioner. I am married and have 2 children. So my journey started about 5 years ago. I would have periodic episodes of pain that would become pretty debilitating. And as the years went on, those experiences or episodes would become more frequent. And in June of 2020, I had an episode that began after I was working out, and that episode did not go away like the other ones had previously done so. When my pain was at its worst, I was still functional to a point. The left side of my neck would kind of radiate into my shoulder blade and then would go down my arm into my fingertips, to the point where that became quite a bit more severe and debilitating than my neck pain at that point. All throughout the day I was experiencing pain. I was having to take, medication, anti-inflammatories, Tylenol, those sorts of medications to just get me through the day. By the time I got home in the evenings, I would just kind of shut down. I was really not sleeping well. That was probably one of my worst times, was when I was trying to get sleep and rest. I have a very supportive husband, a very supportive family, but it does start affecting that side of things as well. I definitely was not myself. I was not a happy person. It starts taking a toll. When my pain wasn't getting better, I knew it was time. So I spoke with my surgeon and we discussed what my options were. As an orthopedic nurse practitioner, I have knowledge firsthand of disc replacement, and I have seen very good outcomes with the prodisc C implant. It's one of my favorites, honestly. Outcomes have been very positive. So at that point, it was decided that cervical disc replacement was the best option for me. When I was in the recovery room after I woke up from the anesthesia, the numbness and tingling down my arm was gone. And I remember tilting my head backwards, and I had that moment of, wait, that doesn't hurt anymore. This surgery changed my life significantly. I'm back to full activity, working out 5 to 6 days a week, pretty aggressive when I do my workouts, and I'm able to do that without any pain. I would say I'm a huge advocate for a disc replacement because my outcome has been so positive in so many ways, but also being on the other side of it and seeing the patients that have had our disc replacements and are doing so well and go back to normal activity. And I can't tell you how many patients come in 2 weeks after their disc replacement surgery and are almost tearful of how their experience has been and how much it's changed their life.